Hi, it's Granny Jenny here, coming from her basement headquarters here in the middle of Nowheresville, America, in a hillbilly state. Um, just wanted to give you some information. I guess part two on Baby C. I was so upset with what I had read. That was the first time I had gotten into an in-depth into what we believe is a leaked document from someone who is just as concerned as we are what is going on with Lucy. I'm going under the assumption that what that information contains is correct. If it is not, I will of course delete the videos and let you know too. But I just kind of wanted to again give you. There is some more information on Baby C that I think that is very, very important. And again, I want to give you kind of a trigger warning here. We Americans tend to use sometimes salty language, and from the state that I live in, again, we have a tendency to express ourselves, and it may not be the most appropriate words that I use, so don't let children listen to this, in other words. And also kind of wanted to let you know that I understand that the last video that I made, there was some audio issues with that. I do apologize. I've ordered a new microphone, or a microphone I can use for this. Do be aware that me as a granny, I'm technologically not so good. So please leave a comment in the bottom. Let me know how good or bad the audio is. I would appreciate it. And hopefully by the time I have my next video, I'll have that microphone for me. Kind of wanted to give you a little bit of background on and a bit of information when it comes to the word stable and how we regard the word stable so far as in the healthcare community. Yes, the prosecuting, the police are using the word stable, Dewey is using the word stable, the consultants are using the word stable, but what they are, and they know, they absolutely know, this is what that word means. When you listen to the news, this what we hear in America, I'm assuming it's back into the United Kingdom as well, is when you hear someone who's been injured severely or has some sort of severe medical condition, you'll hear the word unstable but critical condition. All right, and what that means is that, oh yeah, they could be on that breathing machine. They could be getting all those very important medication that's keeping that heart pumping correctly. But what it is that machine, the medication is working, and it's working good enough to where their vital signs look stable. So no, even though they're using the word stable, technically I don't think they could be charged with perjury, but they know damn well. They know damn well that this is a critical or an intensive care situation, and they may appear to be stable. They're stable right at that minute. But we know darn well if we take that monitor off them, or we take that medication or whatever, that machine off them in a moment's notice, they can or would crash, and there is no way we would do that. I also wanted to give you, when you hear APGARs, this is just certain numbers that are given, like at certain points right after a baby's born, certain minutes, very important minutes. And what it tells you, it gives you a snapshot as what's going on right at this second. And to some degree, it could help tell you what might be going on, what could be going on or headed down your road maybe later on. Certainly if you would have a baby that was APGAR of 0 or 1, that's going to tell you right now that the outcome is not good. But it could very well, and everyone knows, that this baby could come out with a great APGAR. And a great APGAR, those first important minutes right after that birth, but that baby could run out of its reserve and crash any minute. Right when that baby comes out of that womb, the body does an incredible thing. It releases all these wonderful chemicals, adrenaline kind of stuff, to keep you alive and keep you going. That baby wants to survive outside that womb, and it will do whatever it takes. Well, it's appearing fine now. It's giving that cry. It may look real well. It's because of those chemicals. It's that survival technique. But I can guarantee you, and many of these babies did, they may have looked great at the moment of birth, or few minutes after, and those important minutes, but I can tell you right now, they ran out of those reserves. These babies didn't have much in the way of reserves, and they crashed. So, and I do also want to warn you, if you hear me cough or swallow or something like that, I have a throat condition in relation to a belly condition. I had surgery on it, on my belly, and I've improved greatly. So you can imagine what I look like probably just a few months ago. And it's kind of one of the reasons I retired before of age 65. I was having some issues speaking and talking. Kind of wanted to give you kind of a background on a certain trainee that was related to baby C that I'm very upset with. And she was also related to baby A. And remember, stuff is coming out about baby A that it is looking more like the defense and Shu Lee. It was hidden, the obstetrics notes were hidden from that. And certain things were hidden. And it's looking like, and there needs to be more research, that Brewery has done some really, really awful things and been able to change certain documents and present certain documents to important so we say meetings, important boards, important, like maybe even the coroners or a coroner or an inquest or whatever, and been able to switch the things on this baby to make it appear that there wasn't a screw up. All accounts are that Brewery, Salati, and Jerram screwed all up on this one baby. And one of the also screw ups on this, it wasn't the registrar that was at the birth of the baby, but it was the registrar on the day shift of the baby that screwed up and left probably a sicker baby than we had anticipated, and to that register that took it on. And let me tell you, that register that took it on was even worse. All right. Unfortunately, this trainee, I just found out, she is now a neonatologist at Liverpool Women's Hospital and has been since 2021. And I have to question if for some reason it helped in many ways for her to get this, a very prestigious, a very sought after position, a consultant level, especially at the Liverpool Women's Hospital, is my understanding, it's quite a prestigious thing. And we do know that Brewery is an extremely good friend of Dr. Yaxel. And Yaxel retired around that same time. He was a very important figure at Liverpool Women's Hospital. I have no not direct knowledge of that actions, but I have to wonder if somehow her testimony at the trial, or encouraged her to have that testimony at the trial that she had, that she was able to say that both baby A, baby C, and baby F were extremely stable babies. And I'm calling bullshit on that. And her testimony at that trial, I'm disgusted at that testimony of that trial that she gave on baby C. Her using the word stable, her protecting her screw-ups, her protecting of what the baby looked like. The baby died. The baby's heart gave out because it was such severe pain from an intestinal obstruction that it collapsed. Its heart stopped. And the signs were there when she took care of it. She was part of that taking care of that baby. And she was, I believe, a level 3, year 3. And by then, even a first year, they would know. Just some background on me. My first 15 years, I worked at a high-level functioning hospital in my area, and I worked with a lot of, what we call them interns and residents here in the United States, and I worked with, and we call them attendings, so those, you would call them consultants there of some incredible levels. So I know what makes a good trainee, what makes it just an adequate trainee doctor. And clearly no. And us nurses know. We can tell within weeks, right after they leave medical school, who's going to make it and who's not. Who's going to make a good doctor and who is not. We know. And we actually protect them too. And we do what we can to help them. And I can tell you, the level of care that she gave both baby A and baby C, if this would have happened at my hospital, granted, she may have been able to go on to be a consultant, but it would not have been that pipeline that would have gotten her such a prestigious position as a neonatologist at the Liverpool Women's Hospital on that level. Certainly, and I've worked at bad hospitals and I've worked at good hospitals, and I got the hell out of Dodge at that bad hospital and transferred to a good hospital and worked there when I was doing my chart auditing job later on toward the end of my career. But there was a really bad doctor that transferred from that bad hospital to the good hospital, and as soon as I saw his name, man, I made some phone calls to some fellow nurses. He was obviously, he was pushed out, and it wasn't me that got him pushed out by my calls. It was clear from the very get-go. They could tell, and the nurses could tell, and everyone could tell that it would put us at severe risk of not having good outcomes for that patient, and also probably putting us at odds of having lawsuits. That was that bad. I have some fond memories. That first 15 years, it was hard work. I cut my teeth as a nurse, and that laid the foundation for me. But also it laid the foundation for some wonderful physicians that I've had the honor of knowing and seeing them at the birth of their career, right after they got out of nursing school. And I have fond memories of one particular gentleman. That was his first year, which was absolutely brutal. At that time, the hours they were putting in was just incredible and immense. And we knew it, and we loved him. And he was a dedicated physician, and he worked well. We worked well as a team. And I remember there was a point where they reach a certain breaking point where they just can't take it anymore. And we understand that as nurses. Absolutely do. And there was one particular sad patient. It was he had either a leukemia or a lymphoma, one of these, in a really bad type, to the point where we had to give him such severe chemotherapy that we had to put him on the brink of death. It was that bad, in order to hopefully cure him of that just dreadful disease. And he got extremely septic. And as soon as he started showing those signs of that first sepsis, of course, we notified him immediately. And I just remember him, and he had put in so many hours and so much hard work with all the other patients that were dealing with this hospital. I just remember him putting his hands in his face and go, no, don't tell me that. I have to get home. My wife's going to kill me. I got to get home to my wife and kids. I just need to get home. I need to get home. And it wasn't because he was a bad doctor. It wasn't because he didn't care about this patient. Quite the opposite. He just was at his breaking, and we knew it. We knew it, and we cared as much for him as we did the patient. So I did not have that patient on that particular shift. But the nurse that did, she stayed over. She stayed over and helped him as best as she could. We all wanted him home for his wife and his children. He deserved it. He was that good. And I have another wonderful, fond story of when I worked on the surgical floor. The director of surgery, he was head of all surgery at that hospital. And all the trainees, all the consultants, everything. And he was brilliant. He had beyond high expectations of himself. He was probably the leading surgeon in that particular area, a certain area in the brain, probably in the country. All the latest research was coming from him. He was writing the textbooks on this. But let me tell you, he had high standards for himself. And he had beyond high standards for those trainees. He was not a cruel man. He was not mean. He was not vicious at all. But again, the standards that he held for the trainees that we call them interns and residents it was up. You had to give as much of yourself as he gave of himself. And one of the funny things is that, and his outcomes were phenomenal. And he was good to us nurses. We had no complaints about him at all. In fact, he really didn't need to even talk to us much because the outcome in his patients, we didn't need to really verse. We always knew when we would have one of his patients. Yeah, I loved having his patients because I just knew that they came from the OR and they came from the OR in pristine condition because of what an incredible human being he was and surgeon. But one of his rules that he had, and this is back in the 80s and the 90s, is that, oh my gosh, those interns and residents, he better not catch them with scrubs on. No, scrubs are for the OR. You are to dress like a professional. Because when you dress like a professional, you act like a professional. When you present yourself as a professional to the patient regards you as a professional. And it was part of making you feel better, more professional, and you would act more professional. And he wanted his trainee surgeons he cared enough. Unlike these consultants at the Countess of Chester, he cared enough they wanted these future surgeons to succeed. And God forbid there was one wonderful, wonderful intern female, and we would know immediately how well they would be in their future career. They're wonderful. And she made the mistake of one day. She showed up and she was on the floor in scrubs. And she knew it was a no-no, but she thought, oh, he's gone. I'm not going to get caught. Well, that doctor would show up at any given time to make sure, just check. He just wanted to check on his patients to make sure they were doing fine. And she's like, oh my God, he's here. He hasn't seen me yet. I'm in scrubs. And we all loved her and we wanted to protect her. So what we did was we kind of scooted her into our med room. We shut the door and we kept an eye out, and we knew that if he would have just happened to come up on by at the nursing station and asked about her, we would have said, oh, Dr. So-and-so, oh, Dr. So-and-so, oh, she was just here. Oh, she's left. Oh, gosh, I don't know where she went. But, if we see her, we'll let her know that you're looking for her. And and then we gave her the all clear when he was gone. Again, just fun. We would protect each other. And let me tell you, those trainees, we would have fun on those days. I mean, we were in the trenches, we were all under stress, and they were under even more stress, and the hours they were putting in were tremendous. But I'm glad that I was part of their life. I didn't train them, but I was part of that, and I protected them, and maybe, I don't know, maybe did I train them? I don't know. As a nurse, as a colleague, did they learn from me? I don't know, but they learned how to collaborate. They knew that when the nurses and doctors would work like this, the outcome with the patient would be wonderful. And they looked upon us as colleagues and just as important for the patient, and knew that they could not succeed without us. They knew that the patient would die unless we were giving them that all too. And that patient I had told you about, the one that wanted to go home, well, and this is lo and behold, maybe 30 years later, and I had no more contact with that hospital anymore. I'm looking, and when COVID was coming, that pandemic, and we needed a leader in this literally the eastern part of the state who would literally, and we knew that COVID was coming, from Europe our way. We had to be prepared, and they put him in the lead of whatever the group was that would make sure that all the hospitals got together, whether or not you were in that same system or not, to ensure that everyone was on the same page, on the same thing. And when we had a COVID patient during that time, there was an intensive care bed for that patient. There was a hospital for them to go to. That ER was not being overrun, and I saw his name, and I just knew, oh, I remember him. I remember him when I call him when he was a baby, when he was that first year, and I look with fondness, and I just thought, oh my gosh, we predicted it. We predicted it as nurses, he would make it. Again, this registrar that with baby C, the testimony in the trial was disgusting. And by then she was, in 2001, that was a trial that was a 23, and in 21, she was already a neonatologist at Liverpool. I can guarantee you, they did not know how bad she was as a trainee. That was a third year. No way would she would have made it in the pipeline to get that prestigious thing, and had they known. We do know that Breary was an important friend of Yaxel, who was an important person. I believe he retired somewhere around 2021. And I have to question, although I have no direct knowledge, was she given that position as a way to protect? Let me tell you, we are finding things now and now. What just an absolute, what Liverpool Women's Hospital was not at their best during this time. And I'll be putting out a video later on that. He was also part of the transport system. There were babies that were being left at the Countess of Chester. 12 hours. The transport team didn't show up. Even him. There was a baby that was on a severe cardiac meds. One of them is dopamine. The other one is dobutamine. It was so septic. Literally his cardiovascular, or her, I'm not sure if it was a boy or girl, collapsed to the point where it needed this intense medication in order just to survive. He waited 7 hours to call back. I mean, Countess of Chester did the correct thing, calling him saying, I need advice. I need advice. I need help. We need to transfer this baby. And he took 7 hours on such a severe baby that how it survived, just that point, I don't know. It's just sad. It ended up later on dying, and it was part of the indictment. And I have to question, who's protecting this Yaxel? And he is also the gentleman that put out Lucy may have ripped out tubes on people while she was a trainee back in the Liverpool Women's Hospital. I sent stuff over to the Operation Hummingbird to say that how bad she was, and then a few years before she was doing whatever she was doing at the Countess of Chester. No. He needs to protect it too. This registrar was so bad as a trainee. The screw-ups she did on baby A. She screwed up putting in the umbilical line into baby A. It had to be turned out. Instead of putting that line back in herself as a third or fourth year, she had her first year put in. So I think it was because she even said, I wanted to get home by 5 o'clock. She wanted to do banker's hours on that day. She had a first year do it for her. A first year they had to do it and had to figure out a way to do it while the baby was in an incubator. Just logistics of it. And of course that first year screwed up. That baby, we're finding out, baby A, although I am not in any way disputing what Shuley said, and it could have thrown a clot. It could have thrown a clot to the brain or any other major organ. But we're now learning that basically the baby may have collapsed also due to the fact that it ran out of sugar. It didn't have IV access. They let it go so long that it used up all its reserves, and his heart brain could have stopped saying, I can't tell you to breathe anymore. And then his heart could have stopped. This supposedly third or fourth year trainee did not take in, and this is so basic, did not take into the effect that the obstetric notes, she did not know that the baby was at high risk to throw a clot because mom had antiphospholipid, and did not know that the mom had lupus and could have put this baby into a high risk for developing an arrhythmia that could have stopped that heart. Didn't bother. And then she passed this on. Not only did she pass this on, baby, that was completely devoid of any IV access, on to the next registrar. 2 other babies she passed on to him too. This doctor had to put in 3 long lines, which has to be put on. It takes a long time. The doctor has to do it under a sterile situations. Had to do 3 of them. She dumped on him, and she even said she wanted to get home at 5 o'clock. Well, you know what? In my day, you didn't do that. That was not tolerated. And then on baby C, she was the one during the day. And if I would encourage you to look at my previous video about how that baby was in such severe pain over. You could see on several days it had developed a severe intestinal obstruction, so utterly, absolutely painful, it caused its heart to stop. She had that baby during the day. Again, did not take into the account that this baby was half the weight it should be. This baby should have been transferred to a higher level of care. At least she should have called Liverpool Women's Hospital or Alderhay Hospital to at least get surgical or medical advice. The baby needed the day or two before. It had an acute abdomen. It needed an immediate surgical consult and didn't do that. That's how bad. And then she comes in and she's testifying, and even at Thirlwall she's testifying. She's testifying at Thirlwall. She's testifying. I was just shocked when I found out I came in that day that baby's dead. Well, you know what? You're shocked, and I'm angry. I am angry at the fact that all she would have had to do at either Thirlwall or the trial is to say, hey, at this time I was a trainee. Maybe there was something I had missed. That would have been fine. No, I can see through her testimony. All she did was to protect her position as a neonatologist at Liverpool. I can guarantee you, if I was right now in the United Kingdom, if I was a nurse and I was a nurse that knew her as a trainee and then found out she had this position at Liverpool, I would be calling my contacts at just nurses, just regular floor nurses, saying, keep an eye on this one. Because we as nurses knew the trainees who would do it and who would not. Again, you can give them a little bit of leeway, but not this. There was the absolute basic information. Now, what's coming out at the leaked document, I am hoping that this truly is the information that I have is true. If not, then I definitely will. I will let you know. But it's looking like what the consultant sent over. This is just absolutely disgusting. It looks like the consultant sent over kind of I don't know if it's a packet or some information or whatever on the suspicious babies. And this is what they said on baby C. Again, they're saying that, the cause of death, it was heart failure, and which was on the autopsy. It just basically said heart muscle was gone. Well, it's due to the fact that it was the dying process. Well, that consultant let that baby linger for 5 horrendous, painful, agonizing hours in that mother's arms that, yes, did destroy the heart muscle because it was having such severe pain from a severe obstructed bowel. It had a collapsed lung, and a collapsed lung due to that, like that registrar that I've told you about, she screwed up on that intubation and didn't put the medication in correctly. And also, I don't know if it was her or another trainee put in an arterial line on that baby and probably let the blood flow go to the hand, and it probably did. So the baby may have only had one functioning hand. I don't know. And yet the consultants are shocked. And yet on that autopsy, it shows a condition, and it's kind of one of these hard to explain, but basically the baby was so underdeveloped because it was so deprived in utero of important nutrients, of having that good blood flow between that umbilical cord and the placenta, that it only grew to maybe around half the size it should be. So it was still retaining a lot of fetal tissue, and fetal tissue that should have degenerated prior to it being born. Okay, it was important fetal tissue, again, that goes away before this baby is born. Well, the fetal tissue was causing its intestines to kind of stick to the back of its abdominal wall, and that in turn was causing like a twisting kind of a situation in the intestine, and that's what probably led to the obstruction. It is I don't know how common it is, but it is a known thing that, again, this baby was having all these signs that should have absolutely should have been sending out to even trainees that say, oh no, we need to look for that, and they didn't. So again, they lied by omission. If this information is correct, what they sent to the to the police. They lied by omission. They did not state anything to the fact that this baby had a severe obstruction. Did not do that. And Dewey, oh my God, his notes. He had some sort of a meeting with the police, and they were writing down, scribing his words of wisdom. He said, again, he does not mention, and it's clearly in this notes that this baby has an obstruction. And again, what he says, and again, this registrar, she put in on Baby C, the one I'm telling you about, that one that's now a neonatologist at Liverpool Women's Hospital. She put in a UVC line in, and she screwed up again, just like she screwed up with Baby A. She put in the UV line. Either she did or she had her first-year trainee do it, which is just as even worse. You do the work yourself. You don't do it. They first put the line in, and it reached the heart. It shouldn't have gone anywhere near the heart. Well, they pulled back. Well, when they pulled back, they did not secure that umbilical catheter as they should have. There's a certain way. Either you do through stitches or a device. You secure that, and that is your job when you put that in. Our job as a nurse is to make sure that dressing remains on well, or we're seeing any signs that it remains free from anything from the diaper, if you get my drift. But again, they didn't do it, and the line actually fell out of Baby C. So the baby was actually deprived of nutrients, not only in awful pain, but for a few hours, or maybe God only knows how long, was deprived of nutrients and fluid. Again, but what Dewey says in his notes, is they're scribing, and as he's telling the cops his absolute words of wisdom, he's saying, doesn't mention anything about the GI thing. He mentioned that, yeah, the baby could have crashed for the infection, but that UVC line came out, and, well, that's suspicious. And if we can prove that UVC line on a umbilical catheter fell out, then if that's suspicious, that means the death is suspicious. So we need to look into this farther. That registrar, if you're listening right now, I will not use the word doctor. I will not call you doctor, whatever. The word I have for you, it rhymes with witch, and it begins with a B. You knew your failure to do it, and you do damn well your testimony at the trial was going to sink Lucy, because you kept saying the baby was so stable. Oh, there was showing no signs. I was not concerned. The abdomen wasn't distended, therefore the baby was not in any distress. Well, any nurse off the street knows that you can have an obstruction and still not have an abdomen that's distended. That's obvious. Yeah, you may have a abdomen that's distended, but it's no guarantee that you will have a distended abdomen. That is not, again, you're not looking at anything else. She was not looking at the lab values that were clearly showing the sign that the baby's tissue was dying long before. The baby was putting out bilious aspirates, and that is a classic sign of an obstruction. The fact that the baby collapsed in utter agony and a heart stopped should be enough. Shame on you. And what you did, and even your testimony at Thurwall, or I don't know if it's a testimony or whatever your witness statement is, it's absolute garbage. All that you are saying is it is to protect your career. And as a consultant, you know better. As a neonatologist, you know damn well why these babies died. And why are you protecting those consultants? Are you now part of that boys club that does that? Shame on you. You're not worthy of the title of doctor. Take care, guys. Bye-bye.